My name is Sandra Norder. I'm the President and CEO of St. Paul Elder Services located in Wisconsin. I want to preface my comments by saying that the introductory information I am sharing is in no way intended to be boastful or defensive, nor is it intended to reflect poorly on any other long-term care facility, as we stand in solidarity with every other facility that is trying to manage the disproportionate impact of COVID-19 on those we serve and employ. The background information I share is necessary to tee up the analysis of the COVID spread within our facilities and our communities and the untenable situation that every long-term care provider finds itself in right now, particularly here in Wisconsin, and the resulting pleas that we must again make. This is a complex situation with escalating challenges, so my statement is lengthy in its comprehensive assessment, but I ask everyone for patience in listening through to the end. St. Paul Home, which is our nursing home here in Kaukauna, is rated 5 stars for overall quality by the Centers for Medicare and Medicaid Services for our good regulatory compliance history, our above average staffing, and our high performing quality measures and indicators. As a campus of continuing care options, we are blessed to have numerous expert resources on staff that a freestanding nursing home typically does not have the benefit of. We simply have more hands on hand than most facilities do. We have had 3 state inspections focused specifically on infection control, and all have been deficiency-free. Those 3 state surveys were followed by a federal oversight survey, and we received only 1 minor citation as a result of that inspection. We have had the ability to fit test our staff for N95 masks, whereas many facilities have not had the supplies or training to do that. Even having the ability to protect staff with N95 masks, though, is not fail-safe, as there are countless variables related to the use, reuse, fit, and supply of N95s that make it more challenging than anything that is black and white. We have a really well-functioning relationship with a local laboratory, ThedaCare, and they are routinely getting our COVID test results back to us within a matter of hours when our residents display any symptoms of COVID. We have been supported by the state with outbreak and surveillance testing since early summer when we had our very first positive staff member. We have an experienced and involved medical director who is at our disposal 24/7, and her nurse practitioner is in our facility daily. We belong to Leading Age and Leading Age Wisconsin, which are the trade associations that represent nonprofit aging services providers nationally and here in Wisconsin, and which provide us with constant education, updates, policy, and guidance. We read every single professional journal that we can get our hands on in case there's anything we can glean from the studies happening around the nation and world with this virus. Our leadership team and frontline staff have completed significant COVID education provided by the Centers for Medicare and Medicaid Services. We're contracted for housekeeping and laundry services with a professional provider, which offers additional corporate support and guidance to that critical infection control function. Despite our dwindling revenue, we are paying our staff double time for the risks they are taking when they pick up shifts for us or work our COVID unit. We have been in constant collaboration with acute care and other long-term care partners in the area and local public health and emergency operations officials as well. We have an infection preventionist who knows our organization inside and out and is certified in infection control practice. We screen all of our residents 3 times per day for COVID symptoms, and we are extremely strict with requiring our staff to stay home if they have even one minor qualifying symptom and don't allow them to return until they have a negative COVID test. We have a mature incident command process developed from our leading efforts on emergency preparedness. We have understanding and supportive resident families. We have management team members who don't hesitate for a second to work the floor when needed. We were in a strong financial position prior to this pandemic, and we have a chief financial officer who has worked tirelessly to give our organization the best chance we have to survive this. We have a purchasing agent who devotes every second of every day to ensure our staff are supplied with the PPE that they need. We have a rapid response team to provide support on weekends in the event of any significant outbreak developments. We have robust and well-used technology for communication. We have totally redesigned our hiring process to ensure that we can get new applicants in the door, trained, and onboarded quickly but safely. We have environmental services staff who have engineered us air handling solutions, including negative pressure capability in our COVID isolation unit, which is typically only provided in specialized hospital settings that care for airborne infectious disease. And we have a whole convent of sisters and a whole diocesan leadership team praying for us, even as they are impacted by COVID outbreaks themselves. The point of all this is that we have had all the pieces in place and more that would be expected to best mitigate the risk of a widespread COVID-19 outbreak. Yet, since August 19th, we have had 70 of our nursing home residents test positive for COVID-19. We are no less than devastated by the fact that 9 of those passed away during their COVID isolation and care, and another 4 have passed away within weeks of their COVID diagnosis. We have also had 54 staff members acquire COVID-19 as a result of our outbreaks here. Seeing those numbers and saying them out loud is more difficult for me than anyone will ever know, and I know every one of our staff members feels the same way. We are so sorry that even one of our residents has had to feel the pain of this sickness, much less that anyone has had to say goodbye to their loved one. But we have made a deliberate commitment to be transparent about the situation here, with our staff, residents, families, board of directors, community, regulatory agencies, and the media, answering every question that has come our way from reporters. We do that to ensure that the community knows what we need and how our outbreak could affect transmission back into this community. We do that to ensure rumors or inaccuracies and the related resulting damage control required are not taking our focus off of where it needs to be. We have been asked why our outbreak within our nursing home has been so much worse than what is being reported by other facilities or other long-term care facilities in our region. The comparisons are really not apples to apples, and the very bottom line reasons are these. St. Paul Elder Services is a larger and more complex campus than most in our area. We have a vastly larger number of staff in our nursing home than in any of our own assisted living facilities or others in the area, and many more residents as well. The more bodies we have coming through our doors and the more people interacting with each other, the greater the chance of carriers causing transmission. St. Paul Home's residents need much more close contact types of care from staff than any of our assisted living residents do, which also increases the risk of transmission. St. Paul Home has some semi-private rooms, while all of our assisted living rooms and apartments are private. Roommates are considered in constant close contact. St. Paul Home residents generally have a harder time with using face coverings and cough etiquette, as well as with doing social distancing and hand hygiene, than perhaps residents of assisted living facilities are. And also, I cannot confirm whether any other facility in our area is conducting as strict surveillance as we are, whether they are testing as much as we are, whether they are reporting in the same way or as timely as we are, or whether they are being as truthful and transparent as we are, or whether they are keeping their symptomatic residents in-house or transferring them out. That is in no way accusing any other facility of doing anything wrong. I just cannot confirm how we compare to other facilities in terms of how we are reporting our numbers. There is still so much that we don't know about this virus and how it transmits, but we do know that for whatever reason, some people appear to be super spreaders while others are not, and the data backs that up, as 20% of cases caused 80% of transmission. The number of potential super spreaders any long-term care facility has coming through their doors while unknowingly contagious has everything to do with how widespread an outbreak becomes. This phenomenon can be clearly seen on the epidemiological curves that depict our outbreak, which show where the index cases or sources occurred and what followed in terms of case activity. Yes, our staff bring COVID through the door, but that is not a reflection on them. The number one predictor of outbreaks in long-term care facilities is the amount of transmission happening in the communities they are located in. Our staff would not bring COVID through our doors if there wasn't uncontrolled transmission happening in the places they and their household members live, work, and otherwise move about. I can tell you with 100% certainty that our significant outbreak is not because our staff are careless or incompetent. They are tired, they are experiencing trauma, and they are falling ill themselves. They are overwhelmed with constantly changing guidance and situational pivots, even with the constant support they receive from our leadership team. They are being tested twice per week, and anytime they have so much as a headache. They are doing the most dangerous job in America. They are being told that they will be the first to receive a vaccine that has been rushed to production and that 50% of Americans are saying they will refuse to get. And let me be very clear here, we are pro-vaccine, but we demand a safe and independently validated vaccine and stand in solidarity with other facilities and labor groups calling for the same. The heroes who work here are being offered no state or federal compensation recognition for the hazards they are just expected to work through, even as others are receiving enhanced unemployment benefits to stay home, despite organizations like ours all over the country having open positions. They are desperately trying to keep their families healthy too, so that they aren't the one who brings it in here. They are keenly aware that we can pretty conclusively determine index cases based on testing cadence and contact tracing. They live with that anxiety and that guilt for those who have been the ones who have been index cases. While some area establishments will host Halloween bashes this weekend, our staff are going on 8 months of not seeing their family or friends. They are having to make unimaginable decisions under terrible circumstances, like our nurse manager who is undergoing advanced metastatic breast cancer treatment, yet is here all hours of the day when she is needed because she feels such an obligation to others, even at a time when her focus should otherwise be on herself. Or our therapist who is picking up shifts on the floor as a certified nursing assistant despite having a husband at home with an autoimmune condition, because it's simply what our residents need. They are showing up despite us being totally unable to guarantee their safety. It has been made clear to them that we are simply expected by this nation to accept that risk, even as others continue to claim this is all a hoax. The numbers of cases and deaths we are reporting are not fake. We do not report them to stoke fear. This is real, and this is an accurate reporting of our lived experiences. Yes, some people get mildly sick. No, not everyone is going to die from COVID-19. But 13% of our residents who will get it will die from it, and that percentage is based only on the number of residents who died while in active COVID isolation care, as the federal government only counts those deaths as COVID deaths. Anyone who says healthcare providers are inflating death numbers is either not informed or not truthful. Right, wrong, or indifferent, we alone have had 4 deaths happen in the weeks following COVID-19 diagnosis that are not counted as such because they did not occur during active COVID isolation care. The numbers we report are real, and they dictate whether we can reopen to visitation between residents and families who have been separated for almost 8 months now. The crisis levels of spread we are seeing simply make it unsafe to let additional potential vectors come through our doors, especially when the risk that our staff alone pick COVID up in the community and bring it in is so elevated. The tremendous toll that isolation from a family's love has taken on our residents is immeasurable, and it is the price that is being paid for the lack of pandemic responsibility being practiced by so many in our midst. Those who have rejected science are making a deliberate choice to let long-term care residents suffer. Long-term care residents are being protected as best they can, but they are being singled out for isolation in order to do that. They are not being granted the same freedoms that those who ignore science to preserve freedom for themselves enjoy. Indeed, a shadow pandemic with its own death toll is happening in our midst as long-term care residents lose hope, some of whom pass away from the detrimental effects of family separation imposed on them and on us to enforce. While long-term care providers desperately want to reunite our residents with their loved ones to address this shadow pandemic, to do so opens up risk that we would need the world to understand as a trade-off, as we cannot be expected to prevent all infection and all heartache at the same time, with the scarce and dwindling resources we have, the chronic underinvestment in which has led directly to this place. As providers, wrapping our heads around the fact that our residents either endure heartache or elevated risk of a deadly infection is more than we can bear. And that is why we continue to speak out. We are not naive enough to think that we are going to change unopened minds about pandemic responsibility. We speak out to make it clear where we stood so that no one can ever look back and say we did not work hard enough, or advocate loudly enough, or identify precisely enough the root causes of our challenges. To be sure, there will be a significant public record of where St. Paul Elder Services stood and what we did to try to mitigate this disaster. But we truly pray that this encourages increased adherence to the science of pandemic management. We regularly hear firsthand accounts of folks who are sick but refuse to go get tested. We see gatherings continue to happen despite the documented evidence that gatherings of any size are unsafe at this time. We ourselves keep needing to have to run the other way when an unmasked person sneezes suddenly in the store. To those who have asked, what is the answer? The answer is follow the science, period. Following the science has consequences, we know. It is the government's bipartisan job to provide relief to those impacted by our need to follow the science. It is not the responsibility of healthcare providers to figure that out or to continue to bear the brunt of the burden caused by that failure to figure that piece out. I am the messenger here, which is my job as the CEO and face of this organization. This is not a matter of partisan politics, but a matter of humanity. I am not out of touch with what Wisconsinites value, and any attacks on me personally based on assumptions made about my intent with this messaging is deflection. Let me be clear that I care deeply about the people that long-term care providers serve and employ, and that is my only motivation with this advocacy. I am a faithful and practicing Catholic. I grew up in a town of 400 on a farm 35 miles from here and worked like a full-grown man when I was a teenage girl. I worked full-time as a nursing home administrator the entire time I was in law school. I know what hard work is, and I am not afraid of it. But we in long-term care cannot keep going like this. It is not sustainable because it is not humanly possible. We cannot make any assumptions or plan for any relief related to a vaccine that we have no idea whether it will be widely distributed enough or effective enough to make a real difference for us. While we may have early access to some vaccine, we can't even do 2 more months of this. 6 more months would result in untold tragedy. 12 months and we are fundamentally changed and not the same organization, potentially erasing the safety net that we provided this community and our important place in the local healthcare continuum. Everything we've worked for and built is at risk right now. No matter what happens, this will plague us emotionally and financially. We are therefore calling for every elected official to provide for immediate funding for hero pay for our heroic staff, for every Wisconsinite to prioritize full classrooms and full staffing schedules over full non-essential establishments, and for every American to listen to our lived experiences and show the people that we serve that their lives are not expendable, because they aren't. Thank you.